complications associated with type 1 diabetes. This video explains some of the most important complications you can develop when you have type 1 diabetes and what can be done to prevent them. The vast majority of people with type 1 diabetes live a good and long life, but some will experience periods of both high and unstable blood sugar levels. This takes its toll on the body, and as a result, you can develop a number of complications. In general, the complications are divided into those caused by damage to the large blood vessels and those caused by damage to the small blood vessels. Let's start with the small blood vessels. In our eyes, we have very thin blood vessels. These are particularly sensitive to high levels of blood sugar. And after many years with type 1 diabetes, high blood sugar can result in damage to the blood vessels. This can, among other things, lead to changes in the eyes. And in a very small number of people, it can cause impaired vision. A similar thing happens in the kidneys, which clean the blood. Here, the blood flows through very thin blood vessels, which can also be damaged by high blood sugar. The result is that the kidneys slowly lose their ability to clean the blood. Nerves can also be damaged when you have type 1 diabetes. The longest nerve pathways are particularly vulnerable. Among other things, you may lose the sensation in your feet, and this increases the risk of developing foot ulcers. Nerves to other parts of the body can also become damaged. For example, those that go to the heart, intestines, bladder, genitals, and skin. If we look at the large blood vessels, fats in the blood can stick to the inside of the blood vessels. The result is that the blood finds it harder to flow. This causes poor circulation throughout the body and increases the risk of blood clots. The higher your blood sugar levels, blood pressure, and cholesterol is, the quicker the blood vessels will narrow. Complications associated with type 1 diabetes develop slowly, and therefore it can be difficult to detect for yourself that you are ill. As a result, you should regularly go for checkups with your specialist. The checkups allow the specialist to continuously monitor your diabetes and to detect complications early so that treatment can be started. The specialist will also work with you to ensure that you also see an ophthalmologist and a podiatrist. In addition, it's a good idea to inform your dentist that you have diabetes. All of this is important for ensuring that complications are prevented and that they are detected early so that treatment can be started as soon as necessary. Fortunately, not everyone with type 1 diabetes develops complications, and there is a lot you can do to prevent them. It is, however, easier said than done. Firstly, it's important to measure blood sugar levels and to dose insulin correctly. Your blood sugar regulation benefits by eating healthily and exercising. In addition, it's important to have normal blood pressure and cholesterol and to avoid smoking. Finally, it's important to take the medication prescribed to you by your doctor. This will also help prevent or delay the onset of complications. You can read more about the complications of type 1 diabetes at Videncenter.diabetes.dk. Thanks for watching.